If you're someone who loves gardening, but getting up and getting down is killing your knees, I'm going to share with you two exercises, simple exercises that can help you get relief. So, my name is Huang. I'm an occupational therapist, and my goal is to help you live actively in your body without pain. This problem or question actually came from a friend of mine that I went to visit, and she loves gardening. She is trying to grow a food garden. She loves taking care of her orchids, but her knee is starting to hurt. And she's like, Huang, I think I have arthritis. I'm like, why do you think you have arthritis? Just because she's only 60. You don't have to have arthritis. But she thought that she had arthritis because one, it's her age, and two, she's like, well, I didn't hurt it. I didn't bang it. I didn't fall. But there's more to aches and pains in our body than just arthritis. If you have just regular old rheumatoid, not rheumatoid, if you have regular old osteoarthritis, that just means like we have some bony changes as we get older. So there's not like as much cushion from the fluid between our joints. But usually that doesn't mean that you have to live in pain, right? It doesn't mean that you have to live in pain. It just means like, hey, you have some bony changes and that's it. And that's it. But pain can come from, hey, your body's check engine light is coming on and it's telling you like, hey, something's not working as well as it could. Majority of the time it could be due to muscle imbalances. And listen, let's face it, I'm a woman, I'm in my late 40s, and as women, as we get older, we have hormonal types of things happen to us, premenopausal, postmenopausal, and then our bodies, our muscles don't stay as strong, and we have to actually work on it. So sometimes our muscle, like the pains and the aches and pains that we have, are due to some of that, but it's really easy to fix. And that's why I want to share with you two very simple, easy exercises that you could do wherever you are, whenever you are, that doesn't take a lot of effort, right? We don't have to do fancy, complicated movements, just really, really simple ones, okay? So I'm going to share with you two of them today, only two. So one of the exercises is just getting up and sitting down. But what it does here, it really works on your butt muscles, right? So I'm going to take my shoes off real quick. So what you want to do is you want to get onto the edge of the chair, right? And you want to put one leg up. I'm going to put my toe. You can't see. I scoot it back a little bit. So what you want to do is, instead of just doing like a simple squat, if one knee hurts and one knee doesn't hurt, sometimes you have a muscle imbalance between your muscles. Either one leg's always stronger than the other leg, just like you're in your hands. We have a dominant hand and a non-dominant hand, and sometimes one is stronger than the other just based on how we use it. So is the same with our legs. So you can actually put one leg up, one leg out, and then you're going to stand up and sit down. So what I'm doing is I'm just resting my heel on the floor so it can stand up and sit down. So all my work is being done with this leg and this butt, right? And then I can switch leg and say, okay, which leg is easier? Which leg is stronger? I'm going to do the stronger leg. Believe it or not, I know it's counterintuitive. You're like, oh, but let me work my weaker one. This works. Try it out. It's like magic. So you're going to sit on the edge, put your heel forward, get up and get down. You can do 10 of those and then test out your other leg and see if the other leg got better. Again, if we have muscle imbalances, our body is actually trying to tell us like, hey, we need to, work on this. There's no right or wrong. You can work on the quote unquote weaker leg, but you can actually get faster results if you work on the stronger leg, because our muscles are imbalanced and you don't need to know which ones and why it works. But if you try it out and give yourself a chance, you might be surprised that when you do all the work on this leg, it's actually helping this leg as well. I'm going to just share because when I do it to this one is stronger and I could do this one a lot more. And then I'm going to switch to the other side and then I could do the other side afterwards. Okay. But it's really simple. Every time you get up from having breakfast, lunch, or dinner, anything like that, if you're getting up from the computer, you can do that, and it could be a really simple exercise for you to do to help strengthen your hips, like your butt muscles, so that your knee is actually stronger, and supports you so that you can garden and get on and off the floor without any issue. Okay, so that's exercise number one. Number two, I'm going to show you it's actually on the mat. You can do this on the floor as well. So the second exercise I'm going to share with you, you can either do it on your bed or you can do it on the floor. Obviously, if you do it on your bed, it's softer, but on the floor, it can be a little bit better just because it has the sturdiness, right? So all you're going to do is you're going to do what I call a side plank, but on your knees. So you don't have to do it with your feet out like this. Just bend your knees, put your hips forward. So you don't want your hips back like this. You want your hips forward, and it's going to be lined up with your knee. And then you're just going to lift your hips up, just like this, right? And you're going to say, let me try it on this side, and say which side is stronger, which side feels better. So it's going to help you strengthen this side, and this side strengthens too. I have to actually work with this side to hold this side up. So you're not just working one and not the other, but if you work the side that feels good, it'll make the side that doesn't feel good feel better, and then you can work that. Because I find that a lot of times if you have pains, aches, and you're just not sure of like what to do, you won't do it. So if it feels good, do it to the yummy side. But these are the two most simple exercises you can start to do to alleviate some of your knee pain. Obviously, when it comes to muscle imbalances and knee pain, there's a lot more to it, but I'm hoping that these two exercises could help you with your knee pain and help you start to think like, maybe I can get rid of my knee pain, or at least help it be less painful so I can garden, so I can be more active as I age. I wanted to make this video for my friend, and why not share it with the world if it can help you be more active and pain-free as well. Again, my name is Huang Tran. I'm an occupational therapist, and if you need my help, I'm going to include the link below to my clinic here in Miami. I'll talk to you soon. Thanks.